I think one of the things that there's a big misunderstanding is that when it comes to trauma, that once you've been diagnosed with PTSD, that it's lifelong. Yeah. And so one of the biggest things as a counselor educator and as a clinician, I try and convey to my clients and my students is many of the disorders are a spectrum, meaning you may meet none of the criteria down here, and then maybe 1 and 2 and 3, and then there's a point where you actually meet the clinical criteria to be diagnosed for PTSD or major depressive disorder, but it slides. And so you can have more symptoms to where you've got a severe presentation, or you can actually slide off to where you no longer are diagnosable. And I think this is one of the biggest things with veterans and just the general public at large. They just don't understand that, hey, you may have it now, but that's not lifelong. And I think the other big thing that individuals don't really understand about PTSD is this process of there's cures out there. And I know cures, some people shy away from that language, but what I mean by that is you can no longer be a diagnosable. You can be diagnosed, you can do good therapy, whether it's trauma-focused CBT, cognitive processing therapy, exposure therapy.
CBT is cognitive behavioral therapy.
Correct. There's trauma-focused CPT, exposure therapy, and then which is prolonged exposure therapy rather, and then EMDR. And so those evidence-based treatments with PTSD will take the individual, if it's done right and effective, and move them down on that spectrum. And so one of the biggest things I think people just out of a lack of understanding really don't understand it's not lifelong. It doesn't have to be lifelong.
You know, the type of work you do with trauma and PTSD, it's super important, right? Especially within our veteran and active duty population. So